Welcome back to We Are Not Broken, the podcast for trauma survivors. I am your host, Dr. Christie Wylde. And today we are talking about something that it's one of my favorite topics to discuss. And it's probably a little weird because we're talking about coping mechanisms. The reason I really like to talk about them is because, one, for those of us who are trauma survivors, they have gotten us through. They have been a lifeline in many ways. And two, I think it's something we approach completely wrong. And I'm going to talk about why. So I'll start with a little story. This is a patient interaction I had in the middle of my student clinician training. And this person came in just wanting to consult, just kind of do a general conversation about wellness. And as they began to share, there was a significant amount of trauma in their history. But they were at the stage of this understanding where they really didn't yet understand that it was trauma that they had experienced. Had a lot of reasons for why it was good, quote unquote, good for them. And it ended up being a lot for us to hold as the student clinicians in the room. So as the setup of our training went such that there were 2 students for the patient, sometimes only one. We were gathering all the information, all the data, and then we were working with our supervising doctors to create a treatment plan for that person. And the amount of time that the doctors actually spent with the patient was significantly lower because we were taking on a lot of that responsibility. So we spent a lot of time with this person. And as a trauma survivor, I was able to really quickly pick up on the fact that they had experienced trauma, that this had led to some significant addiction patterns in their life, substance abuse, etc., and that at their current stage, they were using cigarettes only, and that was feeling really helpful for them. So doing my due diligence, I asked if smoking cessation, quitting smoking was something that they wanted more information on. At this point, they did not. And so we moved on. We didn't make a big deal of that. My supervising doctor, however, made a really big deal of that and got really defensive and adamant that we had to provide on this day resources for smoking cessation. And I pushed back, because I was the one in that room who had held that container, a safe container where this person felt like they could share what happened to them, even if they did not yet know what it was they had experienced. They had openly shared it with me, and I was not about to go in and take their one coping mechanism away from them. Okay. And you might be listening to this as a survivor and you're thinking, oh my God, thank you. That's all I encounter in the medical professional world is people who want to take my coping mechanisms away from me. And if you're a provider listening to this, you're like, but that's our job. What do you mean you're going to allow your patient or your client to continue doing something that's self-destructive? Well, here's the thing. If we take something away and there's nothing there to back it up, we're setting a person up for failure. And if you're a survivor of trauma, that means you've endured violence against your body, and something has got to get you through that. That's not a how things should go situation. Right. And because of that, then you need something to help you manage the emotions, the recovery process, the moments when you feel triggered, the moments when things feel absolutely overwhelming and out of control. You need tools. And that's what coping mechanisms are. In the medical world, unfortunately, we see them only as self-destructive behaviors. And while that can be an element of coping mechanisms, it's not the only purpose, right? If someone tells me that they're a trauma survivor and they're like, and I smoke cigarettes, and I'm like, yeah, okay, did you survive? Did you make it through? Because if so, your coping mechanisms have served you. Now, the way I look at coping mechanisms now is that, like, let's go back to this patient. If I took the one thing that was helping them get through, then the odds are they're going to go back to the things that were actually harder and harsher because they need something. That's the thing is we look at coping mechanisms and we just think we only see the negative, but the reality is they have helped get us through. So this person had to have something to help them get through. Now, my suggestion was, hey, they don't yet know they're traumatized. And let's get them into therapy. Let's get them a therapist, just as a recommendation for overall life support, because we could all use someone to talk to. And if we can get them to talk with someone, then that person, they'll have a relationship. When they want to start facing their trauma, they'll have a relationship with someone who can help them navigate that. All right. That's a coping mechanism too, having someone to talk to. Let's get this person to do more mind-body practices. Let's suggest breath work on a regular basis. Maybe we get them onto the mind-body shift where they're actually learning breath practices and how that's affecting their physiology. Maybe we suggest something like yoga or Tai Chi, where their movements are softer and gentler, able to allow them to be in their body and have a different relationship with their body. So my strategy with coping mechanisms is, one, let's talk about them, not from a good or bad place, but let's talk about what's getting you through. And let's talk about the other effects of those. So there is a positive effect with that coping mechanism, and that is that it got you through something really, really hard, that your nervous system, that your mind, that your body, that your emotional and mental bodies could not adequately metabolize. And so you reach for something to help you with that process. The other part is, though, what are the other effects of those things? Because it's okay to keep a coping mechanism as long as it's serving you. But when it stops serving you, we want to make sure that there are other coping mechanisms behind that will be more sustainable and will serve you over time. So the way I look at coping mechanisms is not necessarily from the place of good and bad or get rid of them, keep them. It's more like a stratification of, okay, some coping mechanisms got you through, and they're also doing some more damage to you than we would like to see over time. Instead of taking that away, let's build up your arsenal, your toolbox of coping mechanisms. And so that when you're ready to let go of that one, you have others to fall back on. That's personally what happened to me. I used alcohol and cigarettes a lot in my I call them my PTSD pinballing days, because it was like I just was bouncing off of everything. I had PTSD, but I was not diagnosed. I didn't realize I had trauma. I was acting it out 100%, but I didn't realize that's what was happening. So I drank a lot in my, up until my late 20s. That story is wild. I'll share that with you. So I was in this group, like a spiritual direction class through my church, spending a lot of time with the same 7 or 8 people, I think. And there were several attractive men in there who were doing deep internal work, right? That's sexy, right? There's nothing sexier than a good-looking dude who's willing to do internal work. So I was thinking about these guys on a different level. I found out that one of them had been dating another girl in the group, secretly. And it threw me for a loop. I don't know why, but I internalized that as personal rejection, and I just started drinking myself silly. I ended up dancing, and I think it was 60 degrees and raining, which is really odd for the Midwest, but I ended up dancing in the street barefoot in the rain. Don't remember feeling any of that. And then I passed out in the bathroom and almost asphyxiated on vomit. Sorry for that visual. But my friend had to help me not die that night. And for whatever reason, I had committed to doing hot yoga the next day, a special New Year's Day class. So I went to hot yoga with this friend, and it was my first hot yoga class. I had no idea what I was doing. I basically, though, could not even do down dog because of how like riddled with alcohol my body was, and how it was working so hard to detox for me. So I often ended up in child's pose crying because I was so miserable. There was a point when the teaching assistant came by and put her hand on my back, and I really felt like she was praying for me. Like there was a sense of an intercession of sorts where she's just like, please, like, help this girl make it through. Whether or not she was doing that, I don't know, but that's how it felt. And I that was really comforting for me in the moment. I came home completely sober, of course. And the phrase that was going through my mind was, there's no refuge inside of me. Like it was going through my mind over and over again so much that I had to write it down. I wrote it down, I put it on my dresser. And I promised myself at that point that was the last of the drinking. Um and I've had drinks since then. I've been able to, like, not much, but every now and then enjoy something, and that though was the last of the extreme punishment. Like using alcohol, I was realizing was actually becoming a punishment than more than it was a coping. And also that realization that, like, there really was no safe place inside of me. I didn't know, even though I was using these things to cope, I really didn't know how to establish safety in my body. And so that coping mechanism, while it had got me through some things, I had outlived its usefulness. And so I put that down. Cigarettes, though, just gonna be frank with you. I could smoke a cigarette right now. I've just always loved smoking, and and that's not to say I loved how it felt. It could get me through some things, but it would always hit a mark where it rubbed up against my asthma, and I stopped being able to breathe. Which is where we then consider, like, the other effects that your coping mechanism might have. But I really resonated with this person I was describing at the beginning, where they were really in kind of a pre-understanding of their trauma, and smoking was a satisfactory mechanism for them at that point. That really touched my own story, and it made me so defensive for them that I don't remember the outcome if we ended up giving them smoking cessation materials, but what I did give them was like a really robust list of suggestions for building up their personal toolbox before I would even suggest that they took anything away. Because like them, I had experienced that level of instability. And if I had a therapist at one point, she was not a good therapist, but it's not the one I have now. Just in case anyone listening knows who that person is, she's amazing. But this person was like fresh out of school and just like getting her hours for licensure. So she was pre-licensed, and we were talking about coping mechanisms, and I was like, I do smoke. This was prior to med school. And she's like, well, it's not good for you. And I was like, do you know how demeaning it is to say that to someone who's going into medicine, and not just like medicine, but naturopathic medicine? To say that to someone as if I did not grow up with all the infomercials of what smoking will do to your lungs, as if I did not grow up like in a family where my grandmother ended up being diagnosed with COPD and living on oxygen because she'd smoked for so many years. Like, the details I'm aware of. What I had was an emotional connection and dependence on something. And that was the part that needed to be addressed. So I started going to real therapy. By that, I mean someone who is actually qualified to handle my level of stuff. And I was like probably 6 months into that. And I just was actually, no, it wasn't even that long. It's like 3 months. But I was in a stable relationship. I was in stable housing. I was in a relationship where I felt like I could share my trauma and I was seen and believed. That makes a huge difference. My body started to feel safe again. Therapy was helping a lot with that. And one day I just realized that smoking was no longer serving my greater goals in life. And I put it down. And I think I had one or two moments since then. That was in May of 2020. I've had two moments, let's be honest, where I was in extreme overwhelm again and I got a pack of cigarettes. And it took me like 2 weeks to actually work through the pack, and then I was done again. So sharing all this to highlight how just quitting smoking because it was, quote, bad for me did nothing to address the fact that my nervous system still needed support. My ability to move through the world still needed support. And as I began to invest in the coping mechanisms that would support me more sustainably, then I could start to put down the ones that didn't. And as much as alcohol was a thing 15 years ago, at this point in my life, it's almost non-existent. And part of that is because I've got some liver issues because of it. So I have to be much more careful. If I was still living in a state of being triggered and overwhelmed by my trauma recovery, even that knowledge wouldn't matter. It wouldn't contradict what I would consider the need for that coping mechanism. So much of my ability to let go of the actions that were also causing other negative effects to my life has been entirely due to building up my toolbox of support and finding safety in my body. And that has come from breath work and meditation and eliminating the characters in my life who continued to make me feel unsafe and bringing in the characters who saw me and validated me and helped me to reestablish a sense of safety in my body. So it's a process, right? That's the other piece of this whole thing is you're coping for a reason, and that reason is big. It's big and it's heavy, and it's not going to change just because you've gone cold turkey or you've decided this is your New Year's resolution. The need is not going to change. What you can change, though, is what you use to address that need. You can start by adding. This is what I always say. This is actually something a chiropractor taught me years and years ago, was that you always add before you subtract. And this way, you're never in a deficit. That's something I find very important for trauma survivors, especially, is to make sure you're never in a deficit. Make sure that you always have more than you need, because what you need is a lot. And that's okay. That's normal. I'm here to tell you from experience, that's normal and a part of the journey. And there's no shame in needing a lot. There's no shame. You need weekly therapy. You need you need 2 to 3 times a week therapy when things are acute. Get it. You need additional people on your healthcare team. You need a primary care provider and you need me. Get it. That's why I'm here. The medical system as it exists is not set up to understand that you need a lot as a survivor. It's not set up to address that. It will give you 15 minutes a year to get your pap smear and to make sure your blood work is run. It won't even give you the time to understand what's happening with those labs, with your imaging. It just gives you those things and then sends you on your way. And as trauma survivors, we need so much more support than that. And there's no shame in that. So that's why I've stepped into this role, because I needed that too. I needed someone like me to come along and understand that I wanted to change. I wanted to work. I wanted to affect my health differently. I wanted to commit to practices and disciplines that would help me recover and be healthy. But I didn't have someone to help me do that at a pace that worked for me. I had people who were completely willing to see me for the thing I was complaining for, and then I'd have to make another appointment 2 months later, or I'd have to I'd have to come in for every piecemeal thing. And it was arduous. And even then I was explaining why trauma was affecting my health in this way. I was explaining to the ER doc when I came in with weird respiratory or abdominal issues that like, hey, trauma is a part of my picture and they weren't understanding. And so they weren't taking it into account. I needed someone like me who could put all those pieces together. So I'm offering that to you. There's a one-on-one free consult fit check to see if you feel like we're a good fit. It's 30 minutes. You can ask me anything. I'm going to ask you like what brought you here today. And I'm going to share with you a little bit of what I do. And if that feels like a good fit, we'll talk about what that work looks like. That's in the bio. Make sure you go sign up. But if you're someone who is struggling with your current like coping mechanism base, like you want to be doing something different or you sense that you would need to be doing something different, I'm going to encourage you to start by adding something first. Adding walks, adding meditation, adding a service, adding acupuncture, adding something, massage, right? Like body work, adding something that helps you connect back to your body, begin to make peace with that relationship because trauma really fucks up that relationship between you and your body. Begin to make peace with that. Add until you feel like you can't handle anymore, and then reevaluate that coping mechanism. And just know that you don't have to do any of this work alone. This can absolutely be a part of the work that we do together, learning and adding and figuring out what works best for you. I'm here 1000% to support you in that journey. If you're a practitioner and you're listening to this, I hope that you'll keep these things in mind, that coping mechanisms can literally be the lifeline that survivors need. And let's shift our conversation around that. Let's shift our conversation to, you can absolutely ask if they are ready for the resources that they might need to quit a certain thing. But let's take that slowly. Let's take that mindfully and understanding how this is actively serving this person, even if there are other effects happening. And let's start to get our survivor patients and clients the resources they need. Let's add before we subtract. We don't want to set survivors up for failure when it comes to this. I also just want to add a note because I did have another patient story that came to mind of someone who was really struggling with some traumatic things in their life and using alcohol daily. If that is you, do not go cold turkey, okay? Quitting alcohol, and especially if you're drinking a lot, can have really negative effects on you if you're not being supported by medical professionals. So that's just a little disclaimer that if alcohol is your coping mechanism of choice at the moment, please seek support when you're looking to quit. Tapering is going to be really important for you. And this actually can be fatal. So we want you to be as safe as possible. Again, all of this is not medical advice. It is merely for educational purposes. But if you have any questions or concerns, please leave them in the comments below and make sure you go and book your free consultation because I'm really eager to meet you and to work with you and ultimately to help you reclaim your life. Until next time, I'm Dr. Wylde, and this is We Are Not Broken.